Now, when they looked at what you were offering, and I know you would have a number of discussions, and you only really considered 1 out of 5 or 6 people who talked to you, what was the decider for you that said, yes, this person I'm going to help?
Well, first of all, there were many reasons. For example, the patient seemed to be wavering. On one case, I remember very clearly that I had seen the patient twice in his home with a family there in consultation, and we decided that I knew he was rational, and he really wanted this service. So when I came there all prepared to help him, I leaned back just one more time, just on a whim, and got very close to him, and I said, "Do you really want to go through with this?" And he could barely speak, but he made some sound like, "No." I packed up my things and left.
Right now, if someone were to come back to you, doctor, and present themselves in a similar situation, I'm in great pain, I'm terminal, I'm going to die, I want your help to die, would you help them?
No.
Why not?
Why should I go to prison again?
So if that weren't a consideration, you would?
Well, sure it is, isn't it? I lost 1/10 of my life already in prison. I'm not going to lose the rest at this age.
But
the law is bad. It's immoral.
Right.
You don't need a law to practice medicine. You don't tell how to do a heart transplant with laws. You don't tell how to treat a cold with laws. The medical profession handles it, and that's the problem. The medical profession opposes this, calls it almost criminal. It is not ethical, and therefore the law steps in. The medical profession, the AMA, is to blame for this controversy.
What about your view of life? I know how your view of death, and that people should freely entertain it if they're in great pain and suffering, but you had been arguing that life itself can stink, right? I mean, you sound like a very depressed guy on life itself, that it's painful, that it's almost a waste of time. Am I reading that right?
No, the body stinks when you die, not life. But life is an abstraction.
Yeah, you had been saying in the past that with all its hardships and all its tediousness, and without some of the rights that I talk about, quoting you earlier, life is not worth living. What did you mean by that?
Well, I'm not the only one to say that. Some big philosophers have said it. Schopenhauer said it. I mean, some anthropologists have said it. I mean, some people don't feel life is worth living. I had a girl in her early teens who wrote to me and said, "I just don't want to be here. I've just felt this way all my life. I don't want to be here." And she's been through all kinds of psychiatric treatment and diagnosis, had even convulsive therapy. It didn't help. She says, "I'm not depressed. I don't have any pain. I do not want to be here." Now, what do you do with a case like that?
But I guess the reason why I asked, doctor, is you had also said, as someone who had never been married, never had children, I think you said that you never loved, that I would rather not have been born. Who needed this goddamn going to jail and all this trouble? You know, what good did it do? It doesn't do any good anyway. That sounded like a guy almost ready to cash it in.
Well, that's because I'm realistic. That's what saves me. I felt that way long ago. I analyzed it as a kid. I was 10 or 11 years old. I says, "Is it worth going through all this?" No. And all my life I've said, had I a choice, I would have chosen not to be born. What's wrong with that?
Do you still feel that way?
There was no misery.
After all you've been through, do you still feel that way? That it would have been better had Dr. Jack Kevorkian never been born.
Had I never been born, and I was, I mean, if I was being born, as long as I'm not in pain or suffering or terribly depressed chronically, I would say it's worth going on. But when the time comes when it's not worth going on, no. I would say then it would have been better, perhaps, had I never been born. I don't think the ups and downs are even. I think the downs in life are greater than the ups.
Has it been that kind of life?
It's for, I think, talk to people in Iraq, Afghanistan. Ask them if they were glad to be born.
All right, Doctor, can you stick around? I do want to move on to health care, and I know your brief shot at a political career, how that went. You did better than a lot of folks thought when you ran for Congress. We're going to talk a little bit more about that and what your future plans are. More with Dr. Jack Kevorkian.
Okay.
Credit to this. All right, continuing right now with Dr. Jack Kevorkian. And Doctor, good to have you back. And you know, a lot of people know you by that other name. I didn't know it ever went down with you, but Dr. Death. Did that bother you that was sort of like your nickname, Dr. Death, Dr. Death?
Never, never. One of my research projects way back when I was training in pathology was concerned people who were on the verge of death, and I used to make rounds to see who was at that stage, and the nurses coined the phrase, and my friends called me that too.
And you were okay with it?
Why? What's wrong with death? Death is not what you think it is. It's a part of life. It's a part of nature. We're just made afraid of it.
Let me ask you a little bit about, since your mercy killings, however you want to look at it, Oregon, Washington, Montana, among those either having such laws in effect now which would allow you to do what you did, or considering it. And many have been wondering whether others quickly follow suit, and under healthcare reform, whether many more will. What do you think?
Well, I suppose many more will, but they're all doing it wrong. A doctor can't be involved. Well, a doctor can't be involved. If a doctor hands a pill to a patient, he'll be charged and put in prison. Now, where's the AMA on this? Does the AMA support those laws in Oregon and Washington, or no? I don't know. Do they? If the AMA doesn't support them, well, I'm sure they're going to say no because they want to keep their stand, that they're against this. Why? How can you be against a legitimate medical service that was widely practiced in ancient Greece and Rome and Hippocrates' day, and by all the philosophers who agreed with it? Why would you suddenly make it a crime? You can't make a crime with a law anyway. You can just stop a person from using a right.
Well, you know,
That's all the law
Doctor,
does.
your name has been used and sometimes not used or indirectly referred to in this health care reform debate. The President of the United States himself indicating when it comes to caring for our elderly that some tough decisions are sometimes in order. This is from the President earlier.
What you can't do, or you can but you shouldn't do, is start saying things like, we want to set up death panels to pull the plug on grandma. I mean, come on.
What did you make of that?
That's how the religious people think, because their mind is kind of in a straitjacket, you know. Religion puts your mind in a straitjacket. You can't say what isn't in the creed. Emerson said it nicely. He said, as prayers are the weakness of the will, so are our creeds a weakness of... No, prayers are the weakness of something. Creeds are weakness of will. All religion is to make you conform to a different way of thinking that you feel naturally.
All right, and then it leads us naturally to grandmothers. This is from the President. Listen to this.
That at least we can let doctors know, and your mom know, that you know what, maybe this isn't going to help. Maybe you're better off not having the surgery, but taking the painkiller.